morning. Welcome to today's community briefing. My name is Gregory Sneed. Today is the 13th of February in the year 2025. So we are a month and a half into the year. This is also Black History Month. And February only has 28 days. So we're almost at the halfway point of the month already. Can you believe that? And we are almost in the halfway point of the first quarter. So if you've got goals and things you said you're going to get done in Q1, you got another half to make it. All right. My name is Gregory Sneed, and owner and CEO of Lifesaver Financial Services, helping my clients to keep more of the money they make. And now it's my pleasure to welcome to the virtual stage the Black History African American Power to the people, queen of the community briefing, Miss Crystal Mitchell.
Hey everyone, welcome, welcome. Glad to have you. Happy Black History Month, the month that we can be blackety black. It's not just a month, though. We should be blackety black 365 days a year and making sure that we tell our own story so no one else is telling their story. And so it's my favorite month. But in addition to that, there's a lot going on, and so hopefully, I spoke the other day at an event talking about Black economy and Black wealth and all that sort of stuff. And I think hopefully what we take out of this is that we will unite finally and come together as a whole diaspora, and so we'll have a bigger voice. So that's my thing. So that's what I want. But I am Crystal Mitchell. I am the co-director of Recycling Black Dollars, the inspiration behind the community briefing. This platform is our platform. It is the platform where we bring our leaders and stakeholders, the people that are out there with the boots on the ground and the people that are doing things and providing services and opportunities for our community to come and speak to you. And then you can then network with them beyond. So we're just introducing the people to the people. This platform is sponsored and monitored and supported by Recycling Black Dollars and the BBA, which is the Black Business Association. And we're monetarily sponsored by Los Angeles LDC, and we want to thank them so much. They supported us another year. Southern California Edison, PCR, SoCal Gas, and Wells Fargo Bank. I also have my own practice like Greg does, like we all do, and I help and assist our small business community with technical assistance and accounting and bookkeeping training. And I also educate children on how to be entrepreneurs. So that is what I do. And so with that, I am going to, and we have this fabulous team. So you've met Greg, myself, Mr. Stephen Turner, who's our producer, and we are so appreciative to have him. And then Miss Robin Billups, she's the female voice here on the panel, and she is going to introduce herself. So welcome, and turn it over to you, Miss Robin.
Good day, everybody. It's Robin Billups with the Billups Group. I work with clients who are looking to establish a strategic framework around the business plans that they have. And strategy is critically important as we look at what's going on in our lives right now. I think we need to stop focusing on what is happening and understand what we can do about what's happening. I think that I want to just remind everybody that this too shall pass. We've been through this before. This is the sad part about it. They don't get it. We know this script. We know this script. And finally, I want to say that 44 Obama, the musical, is opening up at the Kirk Douglas Theater on February 23rd through March. Don't miss it.
I got my tickets already.
Yeah, the play was written by a young man who, when No 45 got elected, he was distraught. Young white guy, worked on Obama both campaigns, and when No 45 was elected, he said he had to do something because he was losing his mind, and he wrote this play, and it is exceptional. It is truly, it's hilarious, it's exceptional, and it's real. So if you're into theater, you will love it, and if you're not into theater, you to see this here and see this story. Good day, everybody.
Okay, so it's back to you, Greg.
All right. Welcome back. So, our guest today is Miss Jane Reese-Wilkens, and she is here to talk to us about things that are going to be impacting either ourselves or our relatives and parents. And so, we're going to be talking about insurance and Medicare and how to properly position yourself to get the most coverage. Certainly, as we get older, we are in need of healthcare. When you're 20, you got healthcare insurance. You may never use it if you fall or something. But as we get older, we certainly need that coverage. So Jane Reese-Wilkens and Associates, she's the business owner. She's been doing that since 2012. And prior to that, she also has some background with New York Life Insurance Company. She is the founder and president of the organization, and the primary goal is to provide the most up-to-date information on all the options for your protection overall. And she's also a representative of Covered California, so able to give you some peace of mind when it comes to medical insurance coverage. And there are programs that, medical insurance is crazy expensive. And so if you have income challenges, there are some resources available that she'll be sharing with us momentarily. We didn't get a chance, as I usually do. I like to cover somebody's background. I have no idea where she's from, where she grew up, where she went to school. You did go to school, right? So she's going to share all that information with us. And so please join me in welcoming to our virtual stage here, Jane Reese-Wilkens.
Hi, everybody. Let's see, I can't see this. Hold on. Hi, good evening or good morning, everybody. So today, well, you guys are going to share my screen for me, right? But I'm just going to say a little bit about who I am and what I do. I live in the San Gabriel Valley, and I've been involved in insurance, I guess, for almost 30 years. Senior insurance has become my passion because I see that people are so confused when they turn 65, and there's a lot of older seniors that just really don't understand it. And so I have really learned that this is my purpose, because sometimes I'm going to be the only one that they talk to or the last person that they see that day. So I really enjoy what I do. I do cover California. I'm not going to get so much into that today, but it does give you a subsidy depending on your income. So if you do not have insurance, you should have something. Nobody should be without any insurance. You can reach out to me for that service with any questions. But today I wanted to focus on Medicare. I'm just going to do a brief Medicare 101. I'm going to go through it as fast as I can because I know I only have 30 minutes. Okay. And so I am a senior benefits consultant. Okay. I represent many plans. Most of those plans you get in the mail when you turn 65, I represent those. There's no cost for my services. I'm not biased when it comes to the plans. I'm always looking for a plan that's going to work best for you, and they all pay me the same. Okay. So I'm the person that when you get ready to turn 65, I give you your options. Or if we're in open enrollment and you would like to change your plan, all the plans basically have the same core benefits, but some plans give you more bells and whistles. So during open enrollment, I may get a client that comes to me and says, look, I need more dental for 2025. So there is a plan this year. It's a Medicare Advantage plan that gives you $3,000 in dental for the year of 2025. And it's actually a PPO dental plan within a Medicare Advantage plan. So those are the kind of changes, or someone may say, I'm now on dialysis. I need a plan that gives me more transportation. Okay. So I'm going to give you a brief 101 as soon as my presentation comes up. Thank Thank you.
As I bring the presentation up, we do ask our guests share where did you grow up, where are you from,
Okay.
and
Oh, okay. I'm
where did you go
sorry.
to school?
I grew up in Pasadena, California, and I've been doing this for 20 years. I have one daughter. She just graduated from the University of Oregon, and I've been doing this for about 20 years. So that's all.
Okay.
She has an amazing daughter that was an
Okay.
incredible tennis player, and she went to school on a tennis scholarship, right?
What did you say that she what?
And she played tennis, and she went to school on a. Did she go on
Oh,
college?
she did play tennis, and she was also a 2020 Rose Princess.
There you go.
Yeah.
There you go.
Yeah. Okay. Okay, we can move on. Should I just raise my hand when I'm ready for you to go to the next slide?
Or yeah, you can do it verbally as well.
Okay. Okay, so who's eligible for Medicare? So when you turn 65, you are eligible for Medicare, or if you're totally disabled and you've been totally disabled for a period of 24 months. I have some clients that are only 20 and 30 years old. And so basically, yes, if you have not worked in 24 months, you can apply to get Medicare. Or if you have end-stage renal disease, okay, or ALS. Or if you have been in this country for a period of 5 years, okay? If you're not from the country, but if you have been in this country for 5 years, you will qualify for Medicare. Next. So what happens is when you first come to me and you say, Jane, I'm getting ready to turn 65, the first thing I'm going to ask you if you are still working. And if you are still working, and if you're on an employer plan, and the employer plan is over 20 people, you absolutely do not have to get your Medicare at that time, okay? So I have a lot of people that will call me and say, oh, I need to get my Medicare. I still have my employer plan, but my friend said, if I don't get my Medicare, they're gonna penalize me. And that is absolutely not true. As long as you're in an employer plan that is credible coverage, or if you are a veteran, you do not have to get your Medicare. So I may have people that may call me and say, I'm 68 years old, I just stopped working, now I want to get my Medicare. They will open up a special enrollment period for you to go on your Medicare, okay? So let's say, and if your employer is not paying for your insurance, and if you're paying for it, I would compare it with the Medicare plan, because sometimes it makes more sense to get the Medicare when you're working. So the first thing I'm going to do, I'm going to have you do, when you come to me, I'm going to have you do an application with the Social Security office. If you are receiving Social Security benefits, you do not, they will just send you a card automatically. You do not have to call and do an application. Okay. You can, if you're not enrolled in Social Security, you can enroll by, if you're tech savvy, you can go online to www.ssa.gov, or you can call them and you can request to do an application over the phone, or you can go to the office. All right, you can move on. So once you apply for Medicare, there's 4 parts that you have to have in total in order to go into your plan, or to go into the plan and just have everything. You want to have part A, B, C, and D. Okay. So when you first qualify for Medicare, when you call and you do your application, part A covers all the hospital insurance. Okay. So if you have worked and if you have paid into Social Security for a period of 10 years, you automatically get Part A and you do not have to pay for it. Part A covers hospital care, skilled nursing, hospice, and home health. We can move on. And there's, yeah, so if you have not worked and paid into Social Security for a minimum of 40 quarters, and let's say you have only 30 quarters because you don't have to pay if you worked for 40 quarters, it will cost you $278 a month for Part A. And if you have less than 30 and you haven't worked at all, or you have not worked at all, you will have to pay $505 for Part A, okay? There's some clients that will come to me and they'll have Part B, and I'll say, hey, what happened to Part A? And they'll say, well, I never really had a job. I never really paid into Social Security, okay? You can move on. So that's Part A. So Part B has everything to do with the doctor visit. All your preventive services, outpatient surgery, emergency care, diagnostic treatments, durable medical equipment, your labs, your x-ray, that's all Part B. Now, there is a fee for Part B, not for Part A, but there is a fee for Part B. And, oh, I'm sorry. That fee this year for 2025 is $184. And it's, no, I'm sorry, it's $185. That comes out of your Social Security if you're getting Social Security. If you're not getting Social Security, they will bill you quarterly for that fee. If you are a single person and you make over $90,000 a year, you will pay higher. You will pay a higher cost. Or if you are a couple and you make over $180,000 a year, you will pay more. I can't give you that total, but Social Security can. Okay. You can move on, Gregory. Okay, so here's the penalty that some of you may have heard about it. You may have heard about it. It's a late enrollment penalty. So when you turn 65, and if you are not enrolled in an employer plan and you don't enroll in Part B, you will receive a penalty if you go a whole year without being enrolled in Part B. They will charge you 10% of whatever the cost of Part B is for that year that you missed it. So this year it's $185. So I believe that would be $18.50. They will add that to your Part B payment for every year that you missed, and that is a lifetime penalty. So I have clients that will call me and say, hey, I've had this red, white, and blue card. I've never been sick. I never enrolled in a plan, and it's been 5 years. Okay. So times that by, what they have to pay for Part B. And then when they finally enroll in Part B, they have to pay the past, that 5 years that they miss, they have to make up those penalties, and that's a lifetime penalty. So it's always good to find out exactly what you have to do when you turn 65. Okay, we can move on.
And that happens rarely, right? Our people never late on taking care of paperwork.
Oh, yeah. You'd be surprised. Okay, you can move on. Thank you, Greg. Okay, so now that let's say you get your card, you apply, you have your card for Medicare, right? They send you that red, white, and blue card, and it's going to say Part A and it's going to say Part B. If you took that to the doctor, you would be responsible for 20% of that because it doesn't cover you 100%. So that is called original Medicare, okay? So it doesn't cover you for deductibles or co-pays or co-insurance or prescription drugs or healthcare outside the US, hearing aids, exams, screenings, eyeglasses, all the bells and whistles. It doesn't cover you for that, okay? So then that's when you come to me you can move on. That's when you come to a person like me, and then I will help you with C and D, with parts C and D, because A is the hospital, B is the doctor, and then I will help you with C and D. So you have two options when people come to me, you have two options that you can go with. So there's going to be Medicare Advantage plans, and that is an HMO, okay? Or it's going to be a Medicare Supplement plan, and that is sort of the PPO of Medicare. So there's some people that will come to me and they'll automatically know what they want. They'll say, Jane, I want to get a Medicare supplement. I don't want an HMO. I've never had an HMO, and I already know what I want. And so that makes it very easy for me when they come to me and they already know what they want. But then there's some people that come to me and say, you know, I've had an HMO during my working years. I'm comfortable with it. I know my doctor. He's good with referrals. And I want to stay in my network and I want to keep my doctor. And I'll say, okay, then that's what we're going to go with. So when you're going to go with an HMO, the first thing I have you do is send me over a list of your specialists and a list and your doctor's name, because I want to do my research to make sure that I know the plan that we're thinking about, that your doctor is contracted with that plan. And I also have you send me over a list of medications, because the last thing I want is for you to call me at the pharmacy and say, Jane, I can't get my medications, or I can't see my doctor, okay? So let's start with the HMO. So most Medicare Advantage plans in California and Los Angeles County are no cost, okay? There's no cost. So the only thing that you're going to be paying for is that $185 for Part B. So people call me all the time and say, hey, I'm paying $185 for my plan. And I go, no, that is not for your plan. That is for Medicare Part B. That's just the cost to have Medicare. It has nothing to do with your plan. So the Part C Medicare Advantage plans are usually no cost, okay? I have to have a primary care doctor to write down on that application. And then I also have to have a network. So in Pasadena, Optum is really, really big. So most of the specialists are in Optum in Pasadena. I also work with Rego and Prospect and all that in LA. But anyway, I have to put those two things down on the application. And then the prescription drug plan, which is Part D, automatically comes with that HMO plan at no cost. Okay, so you do not have to pay for that. I'm always looking for plans that have very low copays and that give my clients a lot of bells and whistles. So there's a chronic Medicare Advantage plan. So if you have heart disease or diabetes, there's plans that work better for that. So let's say you have diabetes, that chronic plan doesn't charge you for any insulin, and you have more visits to the foot doctor, okay? And then they also have a Medicare Advantage plan that is a PPO Medicare Advantage plan. So that plan does have a small premium, but the copays are higher in that plan. And so I have some clients that say, well, I was on a PPO plan when I was working. I don't really want to get on the Medicare supplement because that premium is higher. I'd rather go on with the Medicare Advantage plan. And then I'll say to them, well, you know, those copays are a little high. And then they'll say, that's okay, we're used to that. So that works for them. So now I'm gonna, so now the clients that tell me, I do not want an HMO, I already know I want to get a Medicare supplement. So that plan also starts out with original Medicare, A and B, okay? Now you have to cover the 20%, right? So that would be the supplement. That supplement does have a premium, okay? And they also have several plans that you can pick from. But usually the ones that we recommend really have no copays. And the most that will come out of your pocket on the one that I sell the most is $240 for it. It's a Part B deductible, like when you go to the doctor, Part B deductible for the whole year. You're only going to have a max of $240 out of your pocket. Now, that plan does have a premium, and that plan does not come with a prescription drug plan. You have to get a standalone drug plan for that plan. Okay, so those are your two options. Okay, we can move on. Okay, I talked about the Medicare Advantage plan. You can move on from this one and this one also. And Medicare, I said that it doesn't come with prescription drug plan, the Medicare supplement. You do have to get a standalone drug plan for that.
Are there certain prescriptions or drugs that are not covered by these plans?
There has to be. If you get on a plan, like when people send me their drug list, right? And let's say there's a plan that's not on there, but this is something that you need. Sometimes they do what they call step therapy. They'll have an alternative drug to that may be less, that will cost less. And then if that doesn't work, your doctor can do an appeal, and then they will cover the plan the drug that you wanted. And then I'm going to talk about drugs more in a minute because of all the things that are happening right now. So these are the two types of prescription drug plans that you can get. You can get the standalone. I just talked about that because if you have a supplement, you have to get the standalone. And then they do come, and then they automatically come with the Medicare Advantage plans, and you must be enrolled in Part A and Part B to get the standalone plan and live within the service area. You can move on, Gregory. Okay, and so again, the Part D also has a late enrollment penalty, okay? So every month that you go without having Part D, they're going to charge you 1% of the national base premium. So that's $36.78. So what is that, like maybe $36 a month? No, 36 cents a month. And again, that goes on for the rest of your life. It's a lifetime penalty. So you have to be enrolled in Part D, just like you have to be enrolled in Part B if you do not have credible coverage. Okay, you can move on. Thank you. So this year in 2025, because of the Inflation Reduction Act, they went down on the prescription drugs. Okay, so that is huge for a lot of people that are paying a lot of money for medications. I have some clients that pay $2,000 a month for drugs, $3,000 a month for drugs. There are grants for some of these drugs with specialty pharmacies, but it was a crime how much seniors really had to pay for drugs. It was just really like, do I eat or do I pay for my medication? So we were happy when this came out in 2022. And because of this law for this year, they went down. Now, you can move on to the next slide. So what's happening is that the max that someone will pay out of their pocket is now $2,000, okay? So no one will pay over $2,000 in the year of 2025 for their medication, okay? And so in 2023, the inflation, because of the Inflation Reduction Act, the co-pays, the vaccines are no cost. The insulin is capped at $35 a month. If you're on a chronic plan, you get that for free. And then they do have an extra help program for lower income people. They can apply and get extra help for their drugs. And then they did take away the coverage gap. I don't know if anybody knows anything about the coverage gap, but you would get to a certain part of the year if you're paying a lot of money, and then the plan would stop paying, and then you had to pay a negotiated cost for the drug. And so anyway, so that is now gone. And then now what they're doing is that if it gets overwhelming before you're capped at 2,000, they now have a payment plan for seniors, which is really, really good. So the cost of the drugs gets spread out all over the year, and then you're not as overwhelmed. Okay?
They used to call that the donut. Was that the donut?
Yes, the donut hole is the nickname for the coverage gap, but that is no longer, that's gone. Okay. And again, so this is what the Inflation Reduction Act did. It's the drugs are capped at 2,000, and they now have a payment plan. And I always give the preferred pharmacy. You always want to go to your preferred pharmacy, because if you go to a standard pharmacy, you're going to pay more. Because I have clients that will call me and go, why was my drug $200 when it should have been only 10? I said, did you go to the preferred pharmacy I told you to go to? And then that is why. Okay, you can move on. So yeah, that's the impact. You can move on. We talked about that. And so extra help for people that need more help paying for their medication. This is what they go by to decide whether you qualify for extra help. So now I'm going to talk about enrollment periods. Okay, we're almost done. Enrollment periods is when you turn 65, you have 3 months before your birthday and 3 months after your birthday to enroll into a plan. So I usually tell people to call me about 4 months before their birthday. Okay, and that way, because once you do the application at the Social Security office, that can take you 3 to 4 weeks to get that card. And so once you, if you do not get enrolled in that 7-month period, now you're locked out, and you have to wait all the way until October 15th, which is open enrollment to enroll, and you don't want to do that.
Is that birthday month?
What'd you say?
Birthday month, isn't it? The birthday month. 'Cause I think you said birthday, but is it the month of your birthday?
Well, what happens is this. So you can enroll in a plan up to 3 months before your birthday, but the plan doesn't start until the first day of your birthday month. So if your birthday is July 10th, that plan is going to start on July 1st. Okay. And then the annual enrollment period is open enrollment. So that is when anybody that's in Medicare gets a chance to change their plan. Okay, and that's October 15th to December 7th. And I usually send a letter out to all my clients, just letting them know this is what's going on. These are your options. And, would you like to make an appointment with me to compare plans or to just discuss what's going on? I usually send out a letter every year. Okay, now, from right now, we are in a period called OEP. So OEP gives you an option to make a one-time change. So if you're not happy with the plan that you enrolled in during open enrollment, starting January to March 31st, you can go into another plan, okay? Or let's say you wanted to change your prescription drug plan and you didn't get a chance to change it over open enrollment. This will give you another opportunity to do that. So, well, no. That's only for Medicare Advantage plans. Now, lock-in period. So pretty much after March 31st, now you have to wait all the way until October to start again, as far as getting enrolled in plan if you want to change. But they do have special enrollment periods during the year. So example, turning 65 is a special enrollment period. They're going to open up a special enrollment for you because we're out of open enrollment. If you develop a chronic illness, which is considered either diabetes or heart disease in Medicare outside of open enrollment, they will allow you to enroll in a chronic plan during the year. So that's another special enrollment. If you move from one county to the next, I just had a client that moved to Riverside County from Los Angeles County. I had to change their plan. And then, or if you move here from another state, then they open up an enrollment period for you. I did want to say that if you're on a Medicare Advantage plan and you visit another state within this country, you can always go through the emergency room. Don't go see a doctor because you'll be out of the plan service area. But as long as you go through the emergency room, that plan will cover you. Now there are some Medicare supplement plans that are national, okay? But as long as you go through the emergency room, they will cover you. My mom was visiting her sister and she got sick and she ended up having surgery and she had to stay there for 3 months. Her plan took care of everything and she never had to pay for anything. Okay.
So not urgent care, emergency room, right?
Yes. Yeah. Emergency room. Maybe urgent care may count too. I'll check on that.
And what happens if you're out of the country? You're on a
Well, you know what?
Jamaica with on the island and
So there are plans, Gregory. I do have clients that will say to me, I'm interested in a plan, but I'm looking for a plan where when I go home to the Philippines or when I'm here, that will cover me. So there are plans that will cover you for up to like 50,000. And then when you come back here, they will reimburse you. Okay.
But those are planned visits. So what about emergency? So because you mentioned in the United States, so what happens if you have a medical emergency and you're out of the country and you have Medicare? Do you have coverage or not?
Well, again, they will cover you for so much. And then when you get back, they will reimburse you.
Got it. Okay.
Mm-hmm. Okay, the next slide. Okay, and then the same with Medicare supplement plans. You have a 6-month window once you turn 65, but most of my clients, if they're going into a supplement, we do it the same way. I usually enroll them just 3 months before their birthday. And with these plans, there's no medical. What happens with these plans is what you should know. You can be on a Medicare Advantage plan and have a chronic illness and move to another Medicare Advantage plans if you want to change, okay? If you do not enroll in a Medicare supplement plan initially when you first turn 65, they will ask you to answer a health questionnaire, okay? Because when you first turn 65, it's a guaranteed issue. But if you enroll in a Medicare Advantage plan and then you say, oh, I want to go to a Med Sup plan, if you're healthy, it will not be a problem. If you're not healthy, it may be a problem. Okay, so that's how that goes. Okay. So star ratings, all the plans have a star rating, and we do have to disclose that to you to let you know the star rating of each plan. You can move on. And then that's it. So when I meet with you, of course, I'm going to ask you for your zip code. I'm going to check and see what plan works for you. I'm going to ask for your primary doctor, your specialist, all your medications, and are you looking for a certain service? I always find out what your needs are, and then you can go to the next slide. And that's my information. And thank you for having me.
So the chronic plan you were talking about is chronic illness, right? That's not the Snoop Dogg plan, right?
So
That's
that the chronic plan in Medicare is usually either diabetes or heart disease.
got it, got it.
Okay.
I was being funny, but okay.
Yeah.
So when I'm sharing, I don't have use of the chat, and that's it would show up
Okay.
on the screen.
Okay.
So I haven't been monitoring chat. So Crystal and Robin, I'll turn it over to you guys
Yeah,
if
Joseph
there was
had a
any questions that
question.
came in.
Yeah, Joseph had a question. Let me get to it.
Okay.
Stop here.
Have any of these benefits and pricings been changed by the new administration? Just really want to know how that's affecting things, or have you seen that
Nothing has changed.
unfold
No,
yet?
nothing has changed.
Yeah.
Yeah. Yeah.
Yeah,
Yeah.
yeah.
Nothing has changed yet.
So, Jane, Miss Wilkins, tell me again, when I'm listening to this, I think that part of it is we wait until that 11th hour. And I took your information, I'm going to share it with my church, because I think when a person hits 40, they need to start thinking about the next 20 years, 25 years, just getting their affairs in order and understanding how Social Security works and
Right.
that type of thing. So when would you suggest, certainly I'll put it this way. If a church or an organization wanted you to come and do a presentation, over and above the fact we're talking about people over 65 years old, who else should be in the audience?
It's really interesting. When people are 40, they are not thinking about Medicare. They are not really thinking about Medicare. I would probably say more, maybe around like maybe 60. That's when people even my 60-year-old friends are not thinking about Medicare. Maybe 62, 63, people start.
64 for sure.
Yeah. Oh yeah, 64. I'm just telling you that Medicare is very foreign to most people. And
That's the impetus for what I'm saying about starting to educate people, because think about it. You got what I call the gap folks. They got kids and they're taking care of their parents, right?
Right.
So the more educated they are about what the offerings are and how to lay things out leading up to that. So maybe 50 is the number that I'm thinking about.
I think 50 would be definitely children that are dealing with their parents. I deal with people that are dealing with their parents all the time. That's another part. And I'm not really allowed to talk about other products when I'm talking, but long-term care, I think, is something that
was my next question.
A lot of people in our community do not look into. So most of these Medicare Advantage plans have a skilled nursing benefit, right? And I don't know if everybody knows what a skilled nursing is, but let's say, for example, someone goes to the hospital because they had a stroke. And you're in the hospital and you've been there for 2 months, but you're still not walking right, then they're going to put you in a skilled nursing facility. Well, a skilled nursing facility minimum is $200 a day. If you're on Medi-Cal, you get that for free. If you're on Medi-Cal, you get to stay for free. If you're not on Medi-Cal, they usually give you a 100-day benefit in the Medicare Advantage plans of a skilled nursing. But let me tell you, once that 100-day comes, they want you out. And then they start to charge you $200 a day. And that is just a minimal facility, the 200. I don't even know if I want to stay in the 200. Well, I
right, correct.
But anyway, that's just, so I get a lot of calls. People will call me and they'll say, oh, my mom's on dementia. We're seeing signs of dementia or Alzheimer's. And I want to know what Medicare plan we can use to get care for that as far as a caregiver. And I just go, they don't cover long-term care. They give you that 100 days. And there are some plans I'm starting to see that will give you 60 hours a year of caregiving or 6 caregiving visits a year. But we really need to understand what long-term care is, because what happens is when you don't, it's too costly. later, but I can't really, I'm not really allowed to talk about
I hear you. I
I
understand
did
that.
file this event, so I don't know if I'm being secret shop, but that is definitely, something that, we can discuss later.
Well, I think that historically we have been able to wait. But in the environment that we're operating in now, people need to be that much more educated about a person like yourself. Just the idea that there's somebody there that can walk you through this.
Yeah.
I think people think they're going to go straight to Medicare and they're going to help them out. Well, those are government employees and blah, 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 blah.
Yeah.
And so again, I'm still on my soapbox about I'm gonna reach out to you because I think
Thank you.
this is the kind of information that people need to have.
Okay.
Especially because we do have folks living a lot longer.
Yeah. Yes.
And I got diagnosed with non-Hodgkin's lymphoma at 62.
Okay. Oh,
Yeah. And I have been working in all this kind of stuff, but then I get diagnosed with non-Hodgkin's lymphoma at 62 years old.
Yeah.
So that's a whole things happen.
Oh, yeah.
Things happen.
But what's really interesting is that most people, and I've learned this ever since New York Life, most people think they're invincible. And even like you said, like I had my daughter, now I'm giving my age. I had my daughter at 41, right? And so
sister,
she wants to live. I know that she wants to live her life because I've had people say to me, "Oh, well, I have kids." And I'm like, okay, and which one of them do you want to give up to? It's not really fair. You should leave something in place to help them, help you. So anyway,
Joseph put a note in here, and this is really good. At 50 years old, you start getting those mailers about AARP and Medicare and all that kind of stuff. So I think 50 is that number. And then can you, that slide with your detailed information on it, can we some kind of way get that into the chat so everybody has your contact information?
Oh, okay.
Yeah, you may need to post that again.
And also,
Stephen has given us your email address. Thank you so much.
That's great.
And also what happens is you get inundated with so much information coming in during the enrollment period.
Yeah.
Even in between the enrollment periods, because one day I was like, "Why are you calling me? We're not even in enrollment period." People,
you know what? And you know what? That's illegal, right? That we are supposed to have permission to contact you, and so you have agents calling you. You have health plans inundating you with all this information, and it looks official, so people get intimidated by it. So when I'm sitting down with people, they're bringing me all this stuff, and I just say, you know what, you can throw that away.
Yeah,
right.
And the only thing you need is your letter from Social Security.
Right, but it gets so intense, and if you're busy or if you don't really quite understand all that, you don't know what you're doing.
Yeah.
And sometimes it comes in so prolifically that even if Medicare is sending you something, that gets caught up in the middle of that, and you might throw it all out because you're like, this is whoa, stop. But yeah, that I think people are very confused. It was a lot. I had to make several phone calls, and I did call Medicare so I could understand. I chose to go with an HMO mainly because everything was kind of pretty much included in there. But I do have a question. So I do outside my dental and my vision is done outside of my plan, and that's the Part D. Because one of the things I found out was that with my dental, I get more benefit if it's outside of my plan than I did if it was within the Medicare family when I went to my dentist. And so I kind of shifted it and went with just a regular dental plan that I pay for, and the same thing with my vision. So I don't know, unless it's gonna be down the line, I'll need Part D. But I didn't get Part D because I already had a plan that I've been using forever, and it's cost effective for me. But yeah, you do have to sign. But with my HMO, so that's back to the question that Greg had. And I believe my plan does, and I know you can't talk about the plans, but I believe my plan does have something out of the if you're traveling. So it would be a reimbursement. Is that how that works?
Yes, I was saying that most of the plans that have things when you're traveling, it will be a reimbursement.
Okay. Yeah. So whether you're in country or out of the country.
No. Oh. If you're in the country, then you just want to go to the emergency room.
Emergency room. Okay. Even
And
with
there
an
is no
HMO.
reimbursement. They just pay for that.
Okay.
They cover
And-
that.
Okay.
Yeah. You just
And
don't
even-
want to go, you just don't want to go see a doctor.
Doctor. Okay. And that's
Now I'll say this, there are supplement plans that do allow you to see a doctor that cover everything nationally. Okay, so there's supplement plans where you can see a doctor and you won't be
Okay.
billed. So yeah.
okay. No, that's very clear. Yeah, it's confusing.
Yeah.
And a lot of people just don't do it at all because it
Yeah.
is so confusing.
Well, I would like to feel like I take the sting out of
the confusing.
out of the whole thing for you, because I help you. I help you navigate through your Medicare years. You don't have to feel intimidated. You can just call me. So that's
Okay.
that's what I do.
Okay. Well,
We just
will
appreciate you being here, and it's just been a joy to get to hear this clarity
Well,
and the
thank
support
you.
that you provide, you know. But I'm like Greg now. What do you do for fun, girl?
Oh,
Well,
that
hold
is
on,
so hard.
before she
I like-
jumps to that,
Okay.
I wanted to emphasize that you want to deal with somebody that sort of lives, eats, and breathes the medical coverage, medical insurance coverage. I'm licensed that I could market it if I wanted to, but I choose not to because I do other types of insurance. And with the medical and the Medicare and the different plans and programs, it can get complex. And so if you're not working with somebody that does this day in and day out, you can be at a disadvantage because any Mo Larry or what's it, Mo Larry and Curly or something could market it, or you get those invites or people calling you on the phone. That can be very dangerous because once you get locked into something, it can be very expensive or it can be permanent. So, and I knew about the penalty, but I forgot that the penalty keeps going, that late
Yeah.
penalty. So
Yeah, crazy.
you lock in that lateness is not just a one-time hit. So I would reach out to someone like Jane or direct out to her to get information on the Medicare and health coverages in general. Covered California stops at age 65. Is that correct? So when you
It does. You know what Cover California does? It will kick you off. It doesn't always stop, but you won't get that subsidy. Because I've had people call me and say, "Hey, what's happening with my Cover California? My plan went up to $1,200." And I said, "How old are you?" They said, "Oh, I turned 65 a few months." There you go. They take
Wow.
the subsidy away when they know that you're eligible for Medicare. But I did want to say something about what you said, Greg, when you said that it's better to have somebody that really knows this stuff, because you can go to State Farm and you can get a Medicare supplement, but with people, there's a lot of people that sell supplements, but they don't take all the certifications for Medicare Advantage plans. So a lot of times when somebody doesn't do this full time, you're not getting all the information. Because I have a clients that go, "I thought I could only get a Medicare supplement." And it's like, no, that's the only thing that your insurance agent sold. So it is good where person like me, I do Medicare full time. This is what I do. And I have to take a major exam every July just to be able to sell senior insurance. And then I have to be certified with the 10 Medicare plans I'm in. I have to take 10 exams every year. So we stay up on all this, just like you stay up on your financial stuff.
I have
That's important.
before you get to your party life. I'm in the HMO with Kaiser, and they don't pay, for everything to do with the glasses. And do you have something that the dental and the glasses will get a reduced price, but they don't cover all of it?
So you have to give me a call outside of this if you'd like to discuss that, because I'm not really allowed to comment on other plans that outside of what I do. But so that would be a conversation for the two of us.
Okay, I'll do that.
Jasmine had a comment before we get to the party.
Okay.
Yes, I do have a question. Thank you so much for your presentation to start. I am a young adult, so to speak, but this sort of thing is really important to me because, like, my desire ultimately is to create a financial plan that's going to make me like that's going to satisfy me holistically, which means that like I look forward to buffering or to including like to being able to pay for this sort of thing for my parent. And so I'm wondering, is there a place or in your expertise, I know that you know the numbers, I'm sure, but have there been like a consistent increase in these costs over time? Like where can I see the projections or make a projection? Because right now my financial plan, it like only even encompasses elder care, but I haven't even thought about like if I wanted to buffer her Medicare expenses, if I wanted to take care of her pharmaceuticals. And so, and yeah, where can I get that information? And is there any way like I can easily share that with my friends too? So.
Well, I can sit down with you and give you that information and then just kind of compare one of the and then another thing, how old are you?
I'm 24.
Yeah. This would be, I'm telling you, this would be a great age for your long-term care. And I say that
Yes,
because
it's cheap, right?
most people your age are not even thinking about it. So it's good that you're thinking that way. And then as far as your mother or your parents with the Medicare, I have to know the situation. I really don't know the situation. So if you sit down and say, this is the situation, this is what my mom is trying to do, and how can I help her? Because there may be a lot more help out there that you don't know about.
Now,
Okay, so you would have to kind of sit down and we could go through because each situation is a cookie cutter situation. But you're definitely thinking along the right lines.
That's excellent, Jasmine, because a lot of us that have taken care of our parents, and they actually got a really an illness, cancer or something. It was challenging to say the least when we were caring for our parent. And if it had not been for the fact that my mom's doctor was a geriatric specialist, and there were she had a plan that didn't really, when we had to go through everything. We had to go through authorization every time she had to have some sort of service. It was maddening. And I spent a lot of time screaming at people and threatening suits of people. And finally, the doctor said, just switch her over back to the complete medical plan, Medicare plan, and you won't have to go through all. And it was the best thing that I did because it was a struggle. The same thing with my uncle. I couldn't get him off of his plan. I switched hers during an open enrollment, and it was so much easier to navigate because when they're sick, that's all you care about is making sure that they're comfortable. So yeah, for sure, have a conversation with Jane to prepare for whatever that may look. And that may be 10, 15, 20 years down the line, but I'll tell you, it will save you a whole lot of headache because it's maddening and they don't listen to your parents. I found that doctors stop listening to you after you're 65, 60. They just hear chronic, that you just nagging. And so having an advocator with a parent when they go to the doctor is vitally important, especially if they've been diagnosed with cancer or something of that nature, because it's way too overwhelming for them. And a lot of times the doctors discard what they're saying. And so they need you, and you need to be tough, girl. That's all I'm gonna say.
Crystal, I will say this one thing. So if you're on Medi-Cal, right?
Medicare.
If you're on Medicare and Medi-Cal, right?
Right.
So if you're on Medi-Cal and Medicare, that works like a PPO. You don't have to be in a plan. You can just be Medicare, Medi-Cal, and that's when you were saying, like your doctor said, just drop it. And then that gives you a lot of flexibility. But if you're not on Medi-Cal and you drop it, then you're only going to be covered 80%. Right. Okay. And so that is when I have some clients that will just come to me and say, I know I don't qualify for Medi-Cal, but I really want to get the Medicare supplement plan. I know it's going to cost me a little bit more, but I'm foreseeing some problems in the future, and I want the flexibility.
Right. Exactly. So, and that's what she basically gave me, because we actually had an Advantage plan that wasn't. It was brutal. It was brutal. So so that's what the doctor told me. But if you don't have that doctor that will give you that advice, then you're just like out there in crazy land. But I admire Jasmine taking the more progressive approach to make sure that she's understanding everything she's going to be confronted with, because our parents are going to grow old, whether we like it or not. And
but the other thing that Jane said that is so critical, that long-term care, when you're 24 years old and you go get one of those policies, it might cost you $100 a year. You know, it's going to be very, very inexpensive. And that's with the way things are being retracted from us. That's a great thing to be thinking about. It really is. Greg.
So thank you so much, Jane Reese-Wilkens, for coming and sharing with us information about Medicare. It can be complex. There's a lot of rules and ins and outs. So it is important to speak with an expert on it. And so I highly encourage you to consult with her, or don't try to go it alone, because there's a lot of pitfalls. Stephen, who do we have next week?
But wait, so before Jane jumps off and before Stephen says that, oh gosh, it just slipped past my mind. Oh crap!
While you think about it,
down, sister.
Okay.
While you think
I
about it, one
know.
thing about Jane, I need to share with it. Do people remember Cookies by Connie?
Cookies by Connie.
Anyone remember Cookies by Connie?
No.
Cookies by Connie.
Yeah, Cookies by Connie. She used to be on billboards for Bank of America and stuff like that. Well, anyway, that's Jane's mother. And,
okay.
Yeah. Wow.
And Jane still a cousin. Jane is my cousin. But
okay.
So Jane, you got those recipes? We want to sample.
I do. Yeah.
We got a witness in this recording. Okay.
Well, during Black History Month, we're gonna have a special session.
She was catering by
Robin, you can tell us about Black History Month next week. For the 20th.
Next week, what we're going to do, we have an open forum going on, but to kick it off, we're going to have the Director of Cultural Affairs for the City of Los Angeles, and Tim Morganfield, who's actually been named as the Program Director for the Vision Theater. So they're going to come on and give us a little update about what's happening in Leimert, and specifically what's happening with the Vision Theater. We again, as we said at the top of this hour, Black history is 365. Matter of fact, it's 366.
That's more days.
Exactly.
On some years, yeah.
If it's a leap year, we might get 367. Now that I think about it. But again, we want to thank all of the folks who dialed in for the first time. We always want to thank our regulars. We just appreciate and value you. And Jane, don't be a stranger. You're part of the family now. You know, and as updates come up, we need you to come back and check in with your family, okay?
Yeah, and that was my question.
This is what we do. When you do a great presentation, it's good information. Now you're the Medicare correspondent community briefing. So you've been officially deemed the Medicare correspondent for the community briefing.
Yes. And so my question was, if there's anything that's coming down the pipe from this crazy administration that looks like it's going to eliminate everything, we all need to know that.
Okay. Thank you, Robin. Thank you. Thank you, Robin. I appreciate that. You know, I'm just staying positive. Just staying positive. The majority of this country are baby boomers, and they don't just look like us. So I'm staying positive and just giving my power to God, and that's it.
Okay. But if you get something,
let's go.
Please come back.
Yeah, you definitely part of this crew.
I will.
You done found your tribe.
I will.
Yeah, so next week, guys, come back. We're gonna have this is gonna be our Black History tribute to our ancestors. And so please come. You know, why is it important to you? I got asked that question. Someone's writing an article about me, and I got asked that question, and I had to go into some thought on why it was so important. And it took me back to ancestors and so forth and so on. But it is very important to us. Just like what we heard at the halftime of the Super Bowl the other day. It was like it was wow. I mean, that was brilliant, first of all, but really drawing in and pulling in, critically thinking how everything that's affected us, and the fact that he had 100 and however million people sitting in that stand, including the new administration. That was right on point. Right on point, man. So that's kind of things that we have to do, and we have to counteract all the stuff that is against us to make sure everybody understands what is positive for us. So thank you, Jane. We appreciate you. We would love to see all of you come back. Hey, Candida Mobley, how are you?
Yes.
I don't think I've seen you. I think I saw you a couple of years ago. So hope all is well with you.
All is well. Thank you for asking. Thank you.
Okay. You guys all remember Candida Mobley?
Yes.
You guys know her? All right.
Yes.
So we're honored to have you, my sister, and Cheryl and Destiny, and you guys, please come back. Tell some friends. The shows that have been previous are over at our YouTube channel. Let me give that to you right now, and you can go over there. We've had some great shows that you would love to hear about if you're just joining us for the first time. And so let me put that in the chat, because sometimes it's a little hard to find us over there. And I will put it in the chat. So grab it and go over there. Our shows are all archived over there from the previous shows. And please subscribe. We appreciate that. All right, everyone. It's 12:08, so we will see you. Happy Valentine's Day to everyone. Hope you have a wonderful, wonderful time tomorrow. And enjoy your weekend. I think the rain should be over, so maybe you can go to dinner on Friday or go on Saturday. We do need the rain. And we will talk to you guys. And please, let's continue to keep that's cute. Please keep our family that lives in Pasadena and Altadena, all the ones that lost their homes. Please keep them in prayer and help out wherever you can, because I hear there's still a lot going on. Yeah. All righty, guys. We will see you next week.
Bye.
Bye-bye. Thank you, Jane.